Hello, this is Dr. Jeff Angobaldo, board certified plastic surgeon, otherwise known as Dr. Plano. Welcome to this episode of the podcast. Today, we'll be interviewing our licensed esthetician. Our med spa has been open for 18 years, and it's grown a lot in the last 18 years. We offer a great variety of services. We have 8 lasers. We have 10 different facials and chemical peels that we offer. And it's a really nice one-stop shop for all of our patients to experience. They don't have to go anywhere else because everything can be treated, any skin type, at our office. Oriana Grant's been our licensed esthetician for some time, and she's very skilled on her facials. People love her, and we're very fortunate to have her as our guest today and as our employee at Dr. Plano's Med Spa. Without further ado, we're going to welcome Oriana to our podcast.
Hello, everybody.
Our first question is, and a lot of people ask, how important is it to be the license for an esthetician?
So, being licensed is extremely important, not only because you want to go to someone who is properly trained on how to work on skin types, skin conditions, and also someone who understands the layers of the skin, but also sanitation is like huge. Like when you're in esthetician school, you are trained on how to properly sanitize everything because of course you're working with sebum and dirt and oil and all the nasty things that are in the skin, and this can cause cross contamination, which can lead to a series of other issues within the skin.
So similar to being board certified in plastic surgery, being licensed as an esthetician is important for safety. And that's always number one at our med spa here in Plano.
Yes.
I guess, people always ask, when you look at someone's skin and their treatments for it, so I guess, an examination is key. So how do you examine someone for a good skincare regimen?
So that's a really good question. There are two key parts within a consultation. Of course, the beginning of the consultation, asking the patient's history within their skincare, what treatments they've had previously, and what they're doing at home and what they might be allergic to. But also understanding their skin type, if it's oily or if it's dry or if it's dehydrated, and that's how you know what type of treatment to do on the patient.
So that's how you tailor it by a good history. An examination is key, and
Yep.
what they've had in the past.
Yes, you're able to customize to that specific patient.
I think the first step with any skincare is a good skincare regimen before there's other treatment modalities that you go up the skincare ladder for the face.
Yes.
How important is a retinol for skincare?
So retinol is used as a tool to kind of train your skin to shed, as it accelerates the cell turnover rate in the skin. Um, a lot of people might not understand what cell turnover is. Basically, what cell turnover does for you is kind of kickstart how your skin sheds on its own. Whenever you get older and more mature, like Dr. A, his skin actually sheds a little bit slower than mine will. Mine sheds once a month. His sheds every couple of months. So whenever you're more mature, you need to take charge of how your skin sheds. So whenever you use retinol, you're basically taking charge of how your skin sheds, which is what will help with fine lines and wrinkles. This will help lighten your wrinkles, lighten your dark spots. The concerns that people have with aging, retinol is used as a tool.
We use retinol also with our strong, heavy chemical peels and lasers to the face. So retinol is like a keratinolytic, so it removes a dead layer of skin.
Exactly.
So using a good retinol for any skincare regimen is really nice because just the retinol itself helps to turn over the skin on its own, helps with fine lines. It helps with acne, acne scarring, but it also prepares you for a better treatment when we discuss those chemical peels and the long, strong lasers that we do at Renaissance. What do you think? How do you treat people of different ethnicities, like someone that has more darker skin versus someone that's lighter? Do you take things into consideration?
Yes, so that is a huge thing within the skincare industry. You don't want to resurface too much because you don't want to lift the pigment. So for patients that have more darker skin tones, you kind of want to build up to doing a aggressive chemical peel. By using retinol or using home chemical peels um, to build up to using something more aggressive. You can't just go directly into aggressive chemical peel when you're a Dr. Fitzpatrick.
So what do you use in your house, let's say, because it's not just retinol. We need like cleansers. There's all sorts of regimens that people use. So what do you recommend for someone that comes in and they want a good skincare line or good skincare products for their face?
So that's a great question. Vitamin C is super, super important because this will help reject any environmental pollutions that we might absorb throughout the day. So, of course, the UV rays in the morning, any just pollution in the air. Of course, there's cars, there's construction. Our skin absorbs this. Um, what else? Exfoliating is extremely big because you are taking charge of how your skin exfoliates and you need to shed off those dead skin cells. You don't want to carry anything that's old on your face or your body. Retinol is very, very huge because, again, you're taking charge of how your skin turns over, and then sunscreen is huge. So, these are four key things that you need in your skin routine at all ages to be preventative, but to also maintain.
So it looks like, in summary, you need a good cleanser to exfoliate. You need vitamin
Yes.
C to help
Yes.
turn over. A good retinol product is important, and a good moisturizer with SPF
Yes,
protection.
yes. Now, I didn't include cleanser and moisturizer because those are mandatory things that you need in your skin routine. If you're putting on vitamin C and putting on retinol without a clean face, you're kind of doing a disservice for yourself.
And also, can you also add maybe a bleaching cream or hydroquinone for patients with sun damaged spots?
Yeah, you definitely can. This would be something that you would use at nighttime because your skin has does the most healing whenever you're asleep. But whenever you're using those treatments, you have to keep your skin routine at a very simple um, routine. Cleanser, moisturizer, sunscreen, and the product you're using designed for your skin concern.
It's I always like when we tell patients about their sun damaged spots, they expect these creams to, get rid of things in a couple of days. It doesn't work that way. These sun damaged spots, these dark spots, it's taken 30 to 40 years to form. So it doesn't happen overnight, unfortunately. But the bleaching cream and good skincare continues. You continue using it, and it takes a
And
couple of
also
months.
treatments too.
Mhm.
Treatments are very, very important, a part of your skin routine. If you have a specific skin concern that wasn't able to be treated by skincare, that's when you come in and see a licensed provider to target your specific skin concerns.
What do you like doing, chemical peels or facials?
So I do like chemical peels because they're very quick. You're able to treat many patients at one time and able to help multiple people at one time. But also, I really do enjoy deep cleansing and kind of just designing a routine for someone. It's really fun to get the puzzle pieces together.
It's interesting because, like, females or people will take care of their nails every 3 weeks or every 2 weeks, but they neglect their skin and their face. And having a good person do a facial, doing really good skincare is what people should be doing continuously. Every 2 weeks for facials
I
or like
agree.
chemical
I
peels.
agree. Some people think that doing a facial every 2 weeks would be too much for their skin. But if you're going to the right person, they're able to gauge what would be too much and what wouldn't be enough for your skin.
So before you joined us at Renaissance, uh, we were only offering like 2 to 5 different chemical peels. Now we offer over 10. I don't know if you can help uh, describe the different chemical peels that's offered, your favorite few, and why you use them.
So typically, there are two types of chemical peels. There's a series of AHAs and a series of BHAs. BHAs are oil soluble molecules like salicylic acid, for example, which would be for someone with oily skin, large pores, anyone with inflammation issues. That's what you would use salicylic acid for. Now, AHAs is more superficial, it's a water soluble molecule. So it's only working on the part of the face that holds water, which is the layer of skin that you are looking at right now. That would be a lactic acid. So this would be made for someone that has sun damage, hyperpigmentation, and or fine lines. And you can actually do AHAs a little bit more often than you could do BHAs also. If you're looking for if you're someone who has both concerns, sun damage, oily skin, acne, you would be a really good candidate for a glycolic peel because glycolic peel acts as a BHA, but it's sensitive like how an AHA is.
And just similar to TCA peels, which are a little bit stronger peels that completely remove almost the top layer of skin, and it takes about 10 days to heal. With these other chemical peels, what's the healing rate? And can you vary the concentration?
Yeah, so depending on how aggressive the patient will want to go, there are peels that are more superficial where you have no downtime. But then, of course, the higher the concentration is, like up to 50%, that's when you'll see more peeling.
I noticed with myself, if I ever received even a light chemical peel, I would sometimes break out with a little bit of acne. Have you seen that often?
Yes, yes. I actually saw that today, actually. What you're seeing is purging. Um, Typically more with an oil soluble peel, which would be a BHA, a salicylic acid peel. It's lifting everything up to the surface. So, of course, things that you haven't seen in your skin before are going to start coming out. But this is only temporary. This is a part of the healing process, which typically lasts 7 to 14 days.
How often can you put makeup on with a lighter chemical peel?
In my opinion, you can apply makeup after 48 hours, but you need to make sure that your skin is closed and you have no sensitivity to your face. Preferably after 7 days, but if you must, after 2 days.
Do you recommend more of an oily based makeup or a mineral based makeup?
Mineral based. Oil based, you'll get more of like the glowy skin, but mineral based is going to be more natural. I'm more of a natural girl. I want to see my skin.
And the oil products
Can clog your
clog
pores.
those pores up.
Hmm. Not made for everybody.
I noticed a lot of people buy products in the mall. You know, they're fancy names, name brands, and they're kind of pricey. But what's your take on, department store skincare products versus what's offered at a medical office?
Medical grade skincare is superior to all skincare in the market because of the clinical testing. And not only the clinical testing behind the products, but the ingredients, the grade of product that is going into your skincare. And I don't believe that the things that you buy at Sephora are designed for people with real concerns with their skin. It's kind of just something that'll temporarily last you. A medical grade skincare product is an investment. You'll see results, but it can be a slow transition. Some people, I always tell my patients to slowly incorporate these products and slowly switch over to medical grade because not everybody can afford it. But also, it's almost just the same as price as buying it from Sephora.
So you always start off with a good skincare line, then facials, then there's chemical peels. And do you combine chemical peels with facials?
I do. A good chemical peel and a good facial is chef's kiss. Like a hydrofacial. A hydrofacial incorporates a peel. It also incorporates a good cleanse, it has extractions, it has exfoliation. It's doing everything you want in a 30-minute treatment.
So what is there in your regular facial and your hydrofacial?
A regular facial is only using hands, which is also good. I don't discourage you from getting a facial, but The hydrofacial includes so many different things in one where you don't need to use different products to do what the machine can do for you.
You know, people always comment on my skin, how they say it's very smooth. But I always tell my patients I always use like I get a hydrofacial every 3 to 4 weeks. And it's for us, when Oriana treats me, it's a very rushed job. Like it's not the full 1 hour experience. It's like I got 10 minutes, need you just to do a facial very quickly. But but she shows me this hydrofacial, like it extracts, and you see like
You see the gunk at the end. It's the best part.
yeah, like that water, it turns like brown. And you see like little
Yeah.
like floaters of acne. I didn't realize my face and skin had all that stuff in it. But it's important to maintain, good skincare and good regimens. Just like
Yes.
nails, you got to do it every 2 or 3 weeks. It's the same thing with
It's
good
the first
skincare.
thing people see. It's important. And a lot of people wait too late to do treatments. And whenever you wait too late to do treatments, you're kind of making up for lost times, but it'll take longer. It'll take an extended period of time to get the results that you want to see.
And then moving up the like skincare ladder, we started with skincare, then we talked about facials and chemical peels and hydrofacials. What about a skin pen? Like, what is a skin pen?
So, SkinPen is actually the number one and only FDA cleared microneedling device in this country. Basically, what it does is it sends millions and millions of microchannels into your skin, which is creating collagen and elastin. It's creating tiny little holes in your skin so they'll be able to bind back together and you'll grow new skin quicker.
So it does help with fine lines, sun damage spots, acne scarring. It's actually a very good treatment.
Yes. It's
Can
actually FDA cleared for acne, scars, and wrinkles.
can you also add like what do you add? Do you add anything to it after a skincare?
I
After
love doing cold therapy after skin pin. So the first sign of healing after skin pin is inflammation. So the face is really hot. Right after I do the skin pin biocellulose mask, so it helps cool down the skin, but it also, whenever I do the cold therapy on top, every single patient is like, "Oh my gosh." They're saying, "Oh my gosh," whenever they feel the mask on their face, but when they feel the cold therapy on top, it's like the cherry on top what they needed. And you need to treat your patients anyways. They deserve that.
how about adding a little PRP to skin
Yes,
pens?
PRP is amazing. It's honestly my favorite. Basically, what PRP is basically we extract the blood from your veins, and then we spin it. Whenever we spin it, we're separating the plasma and the red blood cells, and then we inject that plasma directly into the skin. Whenever you're injecting it into the skin, you're basically injecting the exact proteins and collagen that is used um, to accelerate your benefits that you're getting from skin pin.
Yeah, it's a nice adjunct. It really works in synergy with the results with the skin pen.
Yes.
So this concludes our segments, our episode with Oriana Grants, our licensed esthetician.
Thank you for having me, Dr. A.
If you're interested in consulting with her for a good skin examination and a treatment regimen, you can call our office.
See you guys soon.